Record.
Everybody. Today, Lisa and I are going to be presenting on cognitive behavioral therapy and motivational interviewing as treatments for addiction. The topics that will be covered in this presentation include the philosophy behind CBT, some techniques that are used with CBT for treating addiction, and empirical support, the philosophy behind motivational interviewing as a treatment for addiction, 4 principles of motivational interviewing, the efficacy of motivational interviewing, and some conclusions. The philosophy with using CBT for the treatment of addiction has a few major components to it. One is that behavior is something that is learned and can be unlearned. Another thing is that cognitive processes affect our behavior. So the way that clinicians approach this with clients struggling with addiction and also other mental health issues, because this is kind of CBT in general, is identifying and modifying negative thought patterns, which in turn helps to improve emotional response and behavior in clients struggling with addiction. Another major component to CBT is the use of skills development. So this can involve challenging negative thoughts, increasing coping skills, and problem solving with clients. And another thing that is central to CBT is the focus on the present over the past. Other treatments for different mental health issues, and especially addiction, don't always focus a ton on the present. And sometimes they have a major focus on the past for helping or for identifying the cause of the addiction. But CBT, the philosophy of CBT is to focus on the present, what can be changed now with our cognitive processes and behaviors that are going to promote treating addiction. Some of the techniques that are used or using CBT include thought records. So this can involve helping clients to identify automatic thoughts that they may be having and looking at what may be true about them, what might be untrue, and helping them reframe their thoughts in a way that helps to promote behavioral change. Another thing is behavioral training, and CBT uses homework assignments a lot of the time. Another technique used with CBT is coping mechanism, or helping clients to improve their coping mechanisms. This can be done through enhancing self-beliefs. Assertiveness training is huge with treating addiction so that clients in the future can learn how to be assertive in situations that may be triggering or tempting. And also increasing healthy habits for clients. That is really central to CBT and can be really helpful for clients in treating addiction. Another thing is relapse prevention. This can involve role playing. So helping clients to, and essentially a therapist will role play with a client of what they might do, how they might think and behave in situations where they normally might use, and also enhancing self-beliefs. And last but not least, psychoeducation is a technique with CBT. As for empirical support, CBT has been at the forefront of addiction treatment for decades now. There are multiple meta-analyses to support CBT for the treatment of addiction, and a lot of these involve traditional CBT because it's the most widely used technique for drug and alcohol use disorders. And traditional CBT is essentially just the kind of the basic cognitive behavioral therapy. And then there's additions to this, such as mindfulness interventions, acceptance-based strategies, like I mentioned before, relapse prevention, and motivational interviewing, which we will be transitioning to.
Motivational interviewing is a client-centered yet directed method for enhancing intrinsic motivation to change by exploring and resolving client ambivalence. One of the main goals of the utilization of motivational interviewing in addiction treatment is to work to cut down an individual's use of drugs and alcohol, or simply, and Typically, clients will meet with a counselor between 1 and 4 times for an hour per session to achieve results. Slide. So like I said, motivational interviewing, when used in addiction treatment, it tends to be a short-term treatment protocol. Part of its philosophy that relates to addiction treatment is that motivation is often seen as a well-established predictor of recovery for addictive behaviors. And one of the main tenets of motivational interviewing is that the counselor does not try and convince the client to make certain choices, but rather discusses with the client the possible consequences of making certain changes as opposed to staying the same. Slide. The 4 principles of motivational interviewing. The first principle is expressing empathy, and this involves seeing the world through the client's eyes, and will also involve a fair amount of curiosity and asking questions and being genuinely curious of what the world is like through the client's eyes. The second principle is self-efficacy, and this is something that the clinician is trying to support in the client. So the principle of supporting self-efficacy means the counselor holds the client responsible for choosing and carrying out the behaviors that affect the change in their life. Rolling with resistance refers to the counselor not actively engaging with the client's resistance, but rather rolling with it. In practice, this means that when a client expresses statements that indicate resistance, they don't challenge this, but rather use the client's momentum to further explore their views. And the developing discrepancy, it has to do with a counselor working to help a client see the discrepancies between the impact of their current behavior and how that works against the goals that they've set for themselves. If a client begins to see that their current behavior might not help them achieve these goals, then inherent motivation for change is likely. Slide. So the efficacy of motivational interviewing, it can be used as a standalone treatment alongside adjunct techniques such as CBT or as a prelude to therapy. Slide. So this conclusions, if we're looking at the success rate of people working through addiction and we're considering motivation as a main predictor of success, it seems as though weaving motivational interviewing into the treatment protocol would increase a client's likelihood of achieving whatever goals they're setting in their treatment. Working with the client from a place of empathy also works to increase empathic resonance between the client and the clinician and helps the client to feel empowered through their decision-making process. It seems as though we are working skillfully to reintroduce this concept of self-sufficiency, empowerment, and autonomy. And ultimately, when working with clients through addiction, we aim to help a person get to a place where they can make safer decisions in their lives and attempt to achieve fulfillment in whatever way they deem fit. It's not our responsibility to make these decisions around what fulfillment looks like in a person's life, but through exploring what this means for a client, we help a person develop a sense of autonomy and work to give them back the power that was lost to the addictive behaviors they become accustomed to.